DHT is commonly associated with pubertal changes and baldness in men. However, DHT has various health benefits and possibly is effective at improving certain diseases. Dihydrotestosterone, or DHT, is a sex hormone. It's created from testosterone in the body, and it plays a major role in the development of masculine characteristics, body hair, muscle growth, and a deep voice. DHT is critical to the development of the penis and the prostate. It's a much more powerful hormone than testosterone, and it plays a major role in male pattern baldness. Men with an enzyme 5AR deficiency are unable to make DHT from testosterone and have reduced development and function of reproductive organs. DHT activates androgen receptors needed for sexual differentiation during fetal development and changes in male puberty. It's also necessary for maintaining a sex drive. DHT is a sex hormone created from testosterone, but more powerful, and it maintains sex drive and develops male characteristics. DHT may help those with diabetes and high blood pressure by regulating the glucose metabolism. According to a study on mice, it may lower the blood sugar levels and help with type 2 diabetes in males. Application of DHEA to rats increased the levels of DHT, and it improved insulin sensitivity, weight and body fat. Men aged between 34 and 70 showed improvements in memory when they were treated with DHT skin patches. DHT can improve sexual ability in men regardless of factors like age and obesity. Along with testosterone, it's necessary to maintain a healthy sex drive in men. DHT helps boys who are born with reduced penile function. It's the main hormone to prevent erectile dysfunction in rats. Women with lifelong sexual abstinence were more likely to have low levels of free DHT in the blood. DHT is crucial for sexual health, libido, and erections in men. Higher levels of DHT were associated with lower amounts of fat deposits in the heart of men with coronary artery disease. Lower levels of DHT and testosterone resulted in an increased risk for cardiovascular complications for men who are undergoing testosterone-lowering treatments for prostate cancer. Elderly men with higher levels of DHT have lower death rates from heart disease. In women, muscle DHT level correlates with strength and power. DHT appeared to increase muscle mass in postmenopausal rats. Men are 3 to 20 times less likely to get multiple sclerosis, lupus, rheumatoid arthritis, Hashimoto's, Graves', Sjogren's, and other autoimmune diseases. This may be due in part to male hormones having a protective effect against autoimmune conditions. In animal models, DHT was useful in treating autoimmune conditions such as multiple sclerosis, prostatitis, Graves', and uveitis by balancing the immune system. Specifically, it can lower T helper cells, Th1, that are higher in autoimmune diseases. Sex hormones can have numerous effects on the immune system. The androgens overall can enhance immune response or diminish immune response. There can be enhanced antibody-mediated responses to exogenous antigens, decreased antibody production, enhanced T-cell cytotoxicity, and decreased T-cell proliferation, increased cytokine and chemokine levels, alteration of cytokine profile to decrease inflammation, a decrease in interleukin-6 production, an increase in interleukin-6 and interleukin-10 production, enhanced antigen-preventing cell activation, decreased MHC class II antigen expression on antigen-presenting cells, and stronger innate immune response by increasing nitric oxide production or reducing nitric oxide production. Declining levels of DHT and other sex hormones in older men are associated with declining cognitive function. Testosterone's anti-anxiety benefits were shown to be a result of the action of DHT in the brain. The drug finasteride, which lowers DHT levels in the blood, may induce symptoms of depression. DHT is vital for bone density. Increased blood levels are associated with higher bone density in men. DHT relieves the pain caused by diabetes in rats. Higher levels of DHT were found in blood samples obtained from men with premature baldness. DHT may trigger inflammatory acne. DHT is critical for the normal development of the prostate, but it can also contribute to benign prostate enlargement. DHT can fuel prostate cancer, even if testosterone production is stopped by removing the testicles. On the other hand, men with lower levels of DHT are more likely to get prostate cancer, have an advanced form of prostate cancer, and have a decreased survival rate for prostate cancer. DHT helps the prostate to develop, but too much of it can contribute to benign prostate enlargement. In one study, women who were treated for major depression had higher levels of DHT and other male sex hormones. Finasteride, which inhibits DHT production, is effective in treating women who are suffering from male-like hair growth. Some ways to increase DHT. With lifestyle, you exercise, lose body fat, and do sprinting exercise. Foods and nutrients are dietary fat and zinc with your meals. Supplements that can help to increase the DHT are creatine, DHEA, caffeine, tribulus terrestris, diosgenin, and tongat ali. A drug to help to decrease the DHT would be the 5-AR inhibitors like finasteride. These prevent the testosterone from converting into DHT. Some supplements to decrease the DHT are red ginseng, curcumin, and saw palmetto. Some food and nutrients that can decrease the DHT are black tea, flax seeds, fenugreek, soy and green tea, reishi, copper, nettle root, polyunsaturated fatty acids, especially GLA, vitamin B2, pumpkin seed oil, and amla. Some products that can inhibit the effects of DHT, the Chyawanprash, which is an Ayurvedic Indian jam. Certain tannins and omega-6 in this are anti-inflammatory and they can protect the hair. Berberine with the meals. The herb fu tea. Black pepper, which contains piperine, has also been shown to inhibit androgens like testosterone and DHT. DHT is a powerful sex hormone created from testosterone. It helps to develop reproductive organs and masculine characteristics. It also boosts libido and sexual health. Besides that, some researchers believe that the DHT can support blood sugar control, mental health and cognition, bone and muscle strength and immunity. You can increase it by exercising, losing excess fat, and consuming healthier dietary fats and zinc. Too much DHT can contribute to male pattern baldness, depression and hair growth in women, and prostate enlargement in men. According to some studies, some natural strategies may be able to lower the DHT, including tea, soybean, nettle root, and pumpkin seed oil. Red ginseng, curcumin, and saw palmetto may also help. For more information on herbs, supplements, and natural treatments, check out my website.